Recording in progress.
Well, good morning, everybody. Thanks for joining us either in person or at home. As some of you might know, I'm Tony from Mercy Perrysburg Family Medicine Residency, and as we do the third Wednesday of each month, give a talk on a different medical topic. I also have Abby with me, who is part of our pharmacy team this month, and she's with the University of Toledo Pharmacy program, who's going to be graduating next month and going into the real world. So we're going to tag team on this talk. I'm going to give the first part, and then she's going to talk about some over-the-counter medications and things like that. But today we're going to talk about constipation. And, you know, some people love to talk about their bowel habits. Some people are very confidential or very reserved about talking about those things. But in all honesty, it's something that needs to be discussed because at some point in time, we all get constipated, and it's normal to be constipated every once in a while. As a matter of fact, it's one of the most common GI complaints, gastrointestinal complaints of older individuals. About 4 million people in the United States have constipation. And about 2.5 million people visit the doctor yearly for this problem. Most of these people try and handle things by themselves at home first. Oh, let me try an over-the-counter product. Let me try this or that before they can't take it anymore and go in to see the doctor. But constipation happens when your bowel movements occur less often, and you have to strain to actually excrete the feces or the stool from your body. It affects people of all ages, more so people over the age of 65. And I would say about at least half of individuals who are in like nursing facilities experience constipation. Now that could be for various reasons, which we'll get into. Some of that's diet, some of that's level of activity, some of that's medications, some of that is medical related. I'll talk about these different types of constipation here in a second, but basically, I just want to share, you know, a lot of people ask, well, what's a normal bowel movement? What's a normal number of bowel movements to have? It all really depends on the person. Some people are going to go 3 times a day. Some people are going to go 3 times a week. And then you say, well, how do I know if my bowel movements are normal or not? Well, there's actually something called the Bristol stool chart. And I did not put that up here, but there's different, basically this Bristol stool chart is, and you could Google it, it shows 7 different types of stool. And there's a couple in there that are normal. And then there's some on the extreme end, types 1, 2, 3 maybe are a certain type, and then 5, 6, 7, or 6 and 7 are more extreme, but they'll show you which ones are normal and then kind of go from there. So what causes constipation? Basically, it's hard, dry stools that form as a result of our colon absorbing too much water. So normally what happens is food moves through our colon, typically the large intestine, and the colon absorbs water while forming stool. So I have a little picture here, and I know they can't see it at home, but this is all of your intestine, your small intestine, which is about 10 feet, and then your large intestine, which is 5 feet. So you're talking about 15 feet of intestine. But starting here is your large intestine, and as it starts to move through and starts to absorb more water, this is where you start to get a little bit more hard and unable to push it through. And that's where we start to run into problems. We start to have a lot of backup and everything. So that, and then what happens is your muscles contract and it pushes the stool down toward the rectum. And when it gets too hard, it just can't do that. It becomes slow, it becomes sluggish, and becomes a roadblock. So what are some of the most common causes of constipation? Probably first and foremost, I would say is not enough liquids in the body, primarily water. And I would say that if there's one takeaway message from this talk, is that keep yourself hydrated, water, water, water. Medications are certainly something that can lead to constipation, particularly pain medications. So people that have had certain major surgeries and things like that. And when I'm talking about pain medications, I'm talking about, opioids, um, Oxycontin, things like that. They cause a lot of constipation. So typically, if you're going to be put on some type of pain medication, you want to make sure you're put on a stool softener as well. And Abby will talk about those types of things here in a short minute. Another cause of constipation is lack of exercise. Not only do we want to keep our bowels moving, we need to be moving along as well. And those things kind of go hand in hand. Not enough fiber in the diet. Again, Abby will talk a little bit about fiber. Another thing that causes constipation, as I mentioned earlier, are certain medical conditions. Irritable bowel syndrome kind of goes hand in hand with that. And part of that is, part of the other problem is we condition ourselves to not have proper or normal bowel movements. So sometimes we'll feel the urge and you're like, oh, you know what? I gotta go to the bathroom, but I'm gonna go run this errand first. So you go to the post office, and then all of a sudden you want to go to the grocery store, or you want to go to the bank, and you're just kind of holding things in, and you start to condition yourself, and that tends to lead to problems. The other thing is changes in lifestyle, as I mentioned earlier, certainly old age. If you're a person that travels a lot, what happens is you're on the road, and I was just guilty of this last week. My son lives in Rochester, New York, and you're driving, and you're like, yeah, I kind of have to go. Oh, next rest area is 40 miles away. I think I can hold it for, that long. And then you get to that one that says the next rest area is 30 miles away. Oh, I can hold it again. So you're kind of conditioning yourself. And then certainly for pregnant women, there's issues related to constipation as well. Problems with your intestinal function. Abuse of laxatives is another big one. Abby can probably speak a little bit to that. And then people who have certain medical conditions like strokes, multiple sclerosis, Parkinson's, spinal cord injuries, all those things certainly contribute to constipation as well. What are some of the symptoms? It differs by individuals. So one of the most frequent ones is difficult or painful bowel movements. As I mentioned earlier, people that have bowel movements less than 3 times a week. If you're feeling bloated, very uncomfortable, a lot of us have all experienced that feeling, feeling sluggish, abdominal pain. You have to think about whether these types of symptoms are related to constipation, or if it's something that's a little bit more serious in terms of a medical problem. But as we have it listed here on the handout, there's basically 3 kinds of constipation. The first one is normal transit. And this is the most common. This is where people feel constipated, but the consistency of their stools is normal, and the stools move through the digestive tract at a regular pace. But what happens is some of these people start to experience problems related to abdominal bloating and pain, and we're not sure if that's just, a gas bubble or something like that, as people like to call it, or if it's something that is building up to be a little bit more serious. The second type of constipation is slow transit. And this is where, as I showed for those that were able to see it here, this is where we start to have the bumper to bumper traffic. So, obviously somebody is holding things up at the front of the line, and the rest of your stool gets backed up in the large intestine. What happens then too is the muscles in the GI system start to contract more slowly, causing stool to take a little bit longer to reach its final destination. So when I talk about the slow transit, when it starts earlier in the large intestine and moves through it, it just slows down for some of the reasons that I mentioned. And then disorders of defecation, as it says here, these are more common in the elderly due to normal age-related changes. And the urge to defecate decreases, leading to larger amounts of stool. So if you're conditioning yourself to kind of hold it a little bit longer, maybe you're saying, well, I don't have an accident, maybe I'm at home and I don't have an aid right now to help me get to the bathroom or help me clean myself up. I'm going to hold it, and you tend to run into some problems like that. So like I said, in terms of management, and this is where I'll bring Abby up here, our goal is to decrease discomfort first, and then try and move and get soft stools formed at least 3 times a week. How do we do that? That's where Abby's going to come up and share with us some things over the counter wise and maybe prescription wise to help with med management. I want to come over here.
All right, so my name is Abby. I'm a pharmacy student in my final year from the University of Toledo. All right, so going over some medical management of constipation, we'll go over the non-medical management. So these are things that you can do, habits that you can include in your daily life that you don't have to take medications for. So you have to like schedule bathroom breaks after meals. If you time yourself and be like, oh, I'm going to go to the bathroom every day when I wake up or after meals, if I feel like going, I'm going to go rather than pushing it away. These habits can increase your frequency and help you go to the bathroom more easily. And also there are some steps where you can place your feet on a small stool while you're on the toilet. So if you have issues with constipation and you have a little small stool to place your feet on while you're there, it opens you up and it makes like the movement of the stool easy. Also, you have to allow adequate time and try avoiding bedpans if possible as well. And there's no evidence really to prove that exercise actually heals constipation. But if you exercise, sometimes it can help with the movement of the stool as well. You can also increase your fiber intake. So taking foods that are high in fiber contents will help also increase, soften the stool up, increase your bulk and help you go easily. So you can increase it slowly into your diet to avoid you being gassy, because these are natural fiber, and natural fiber bloats you up and make you gassy, and it might deter you from taking fiber in your food. So if you practice it slowly, your body will adjust to the fiber slowly. So some of the fibers that you can include into your diet is whole grain foods like bread, cereals, vegetables, fruits, prunes, whole beans, or corn. And you just have to know these can make you gassy. So include them slowly into your diet and it will help you. Also drinking lots of water, more water, more water, more water, it will help you go easily. So going over the medications, so all these are over the medication options that we have, over the counter medication options that we have to help you go if it becomes severe and the non-medical regimen doesn't help you and you have to resort to medications to help you go to the bathroom. Our first agent will be the bulking agents. So example of these class of medication is the metamucil. So the class of the brand name that we know out there is the Xylem. So there are different like brands that comes with it. So you might be able to see like the Kroger brand, the CVS brand. You just have to read it. Most of them contain the same active ingredient, and you can buy it. It doesn't have to be the same generic or the same brand. As long as it contains the active ingredients in it, you can use it. And the metamucil is a natural fiber. So if you are taking this fiber medication, you just have to know that it can make you bloated and make you gassy, like if you are taking like the original natural fiber, like the bread and the grains. So just be aware if you start experiencing these symptoms, you can take the synthetic fiber, which is the cetrosol. So these are non-fermentable, so it doesn't make you bloated if you take these agent or fiber. So mechanism of action of this class of medication, they get absorbed into your intestine and increase the bulk of your feces. So it increases the bulk and it will make you go more easier. And with this medication, you have to drink more water to make it more effective. So if you don't drink water with it, it's not going to be able to draw the active ingredient from the medication into your small intestine, and it's not going to work effectively. So if you're going to take the bulk agents, you have to drink lots of water. If you're not going to drink lots of water, you have to use a different option. Our next agent is and also one thing that you have to know with this medication, it takes a while for you to see it working. It might take up to 3 days. So if you want to go instantly, this is not the best option for you. It can take up to 3 days or more for you to see effects of this medication. And you can be on it for more than 7 days consistently. If you're on it for over 7 days, you have to talk to your doctor because you would likely need a different agent to help you go. All right, and our next agent is food softeners. So these are termed as the mash. So they basically pull water from your small intestine and mix it with, it's happening in your body, mixing it with the stools to help you go easily. So it just makes the stool soft. Also with this medication, some examples that we have is the Colace, or popular generic is the Dacusate. So it also comes in different brands, Walgreens brands, Kroger brands, Walmart brands, but just for it to contain the same active ingredient, which is the Dacusate, you can use it. You don't have to use the brand name Colace, which will tend to be more expensive. But if you buy the generic Dacusate, it will be less expensive, and you can go with that. It will work as effective as the Colace brand name. And you have to take it with lots of water because it just pulls the water that mixes with the medication to help it be effective. So you have to take it with water. And our next ingredient is the osmotic agents. So the Merlax, the Goletly, the generic name is polyethylene glycol. So the polyethylene glycol generic is less expensive, comparing it to the Merlax, which is a little bit more much expensive. So these ones, it comes in a powder form, like the methylmucil, so you have to mix it with water. And usually the instructions are on the bottle. It will tell you how much to measure, and some of them comes in packs. So the pack is usually 17 grams. You mix it with a quantity of water and you drink it. So it also draws water into your bowels. So since this automatically mixes its water for you to drink it, you don't have to drink so much water after taking it. And this also takes days for it to be effective. So it can take up to 3 days or 5 days for you to see the effects of this medication. So if you want to go right away, you've been constipated for days and you need something that would make you go right away, this is not the medication for you. But if you need something every now and then, you've been constipated and you need something to soften you up and go later in a day or something, this is a medication that you can use. And also something that you have to note, do not use if you have high blood pressure or kidney disease, you have to talk to your doctor about it. So if you have any of these diseases, make sure you talk to your doctor about it because they contain electrolytes that can increase your electrolyte levels like sodium, potassium, magnesium. So you make sure you talk to your doctor about this medication if you want to take it, if you have high blood pressure or kidney disease. And the last option is the laxative. So these are termed as the rush. So these increases your peristalsis, like increases your gut motility, and it pushes the feces and it will make you go. So these medication, if you want to go, if you take it, let's say if you take it this evening, you would go in the morning. It takes about 6 to 8 hours for you to see the effect of this medication. And if you are taking the suppository form of it, which is prescribed, you should see the effect within 30 minutes. So it's that quick. Examples of this medication is the Daculus, and it comes in the suppository form, or the Senacot, which is popularly known as the Sena. So the Senacot and the Dacusate comes in a combination form that you can also find over the counter. So if you're trying to find only the Sena or the Dacusate, make sure you read the label on the medication because some of these comes in combination forms. So with this medication, do not take regularly. do not take more than 3 days consecutively because it can increase your dependence and decrease the effectivity of this medication. And if you, as Connie said, if your doctor prescribes you any opioid medication like Percocet, Norco, make sure you tap and they don't prescribe any laxative with it or any school stuff now with that medication. Make sure you talk to your doctor about it, because if you end up developing any opioid-induced constipation, even after finishing the course of the medication, it will not go away. So you have to talk to your doctor about it and make sure you treat the side effect of being on having opioid-induced constipation. Okay, let's go to the picture. All right, so these are like the pictures of the medication that I've talked about. Some of them, it will have the brand names like this, but make sure you read the packages because they might have other ingredients in it that you don't want to be taking. So make sure you pick the boxes from the OTC out at your neighborhood pharmacy. Make sure you read the packaging because it might have the same brand name, but it might contain some ingredients that you don't want to take. So, yeah.
And again, if you're not sure, that's why the pharmacist is there. They're there to provide education, not just for the prescriptions that you're picking up, but for some of the over-the-counter medications that are available. Because how do I know? Do I need the mush? Do I need the push? Do I need the rush? You know, you got to figure that out. And again, the pharmacist is there certainly to help you get those questions answered, so that you get the care and the relief that you need. Also, she mentioned earlier about, you know, putting your feet on a stool. I'm sure many of us have heard of the squatty potty. Somebody made a lot of money just coming up with that. But basically what happens is, you know, you're kind of like this. And then when you put your feet up or you lean forward, if you don't have a stool, it kind of goes like this. So it's about your plumbing. And it just opens things up and allows things to move more freely. So again, somebody figured out how the digestive tract and the intestines and everything work and put that together, and they're living well. So that's about it. Any questions? Okay. Well, thank you very much for your time. I appreciate it. I hope you have a good month. Next month, we will be back talking about stroke risk in older adults.